My name is Caleb Ainakwa. This is still Assassin Radio's public interest news campaign aimed at making the Accra Tema Motorway safe. It's hashtag Safe Motorway for All, and today our guest is the Vice President of the Ghana Medical Association, Dr. Justice Yankson. And today we are talking health and safety on the motorway. We'll bring to light the statistics as regards carnages generally and specifically on the Accra motorway. We'll also get some medical perspectives as well as some public health concerns amongst users who use the Accra motorway. Doc, I want to find out from you, when was the last time you used the Accra motorway?
So then that should be a little under a month ago. Yeah, let's say about 3 weeks ago.
Let me guess, your experience wasn't that pleasant, was it?
To be honest with you, part of my childhood and even till now is actually based in Tema, even though I live in Accra. My parents, you know, were domiciled in Tema for a greater part of their lives. So, at least throughout my lifetime, I've seen the motorway over the years because we used to travel on the same when I was a kid on regular basis from Tema to Accra till today. And to be honest with you, the experience back then was way, way better than what I have today.
Hmm. And what exactly caught your attention? For me, usually the potholes do. What about you?
It's one phenomenal thing. I mean, but back in the day, you ride on the motorway and it was such a pleasant experience because the road itself was safe. The road was, in quote, smooth, and it was what you can describe as a proper highway. People who drive on the motorway, you always will see them obey the rules, i.e., the fast lane was for people who were to move
Yeah,
and overtake, while the slow lane was for these trucks and others.
exactly.
And everybody obeyed the rules. Back then, hardly will you see somebody even crossing the motorway. But what do you see today? Tricycles, human.
Oh, yeah.
It's a mess. And sometimes you will find these tricycles who are actually in the fast lane. And you ask yourself, do they even understand how the motorway works and what the fast lane is even meant for? Meanwhile, they're in the fast lane and probably moving at around 5 or 10 maximum kilometers per. I even doubt if they get to 10 kilometers per hour.
Mm.
And it causes a lot of, traffic, a lot of nuisance at times on the road. Sometimes you find heap of rubbish being dropped on all kinds of things. Then the general state of the motorway itself has also become a bit problematic because, as we all see, the road is not in the best of shape. Yes, over the years, governments, past and present, have tried to fix it one way or the other, either a bridge or some, segment of it. But clearly, we need to up our game in terms of what it is. And if I remember correctly, at the time, the history I got from my parents back then, whilst we were riding on, I think it was supposed to last a minimum of 50 or 60 years maximum.
And it's exceeded. I mean,
And
it's
it's
almost
exceeded,
60 years,
yes.
58.
So clearly, we haven't done justice to that road, even though it has served as well. Let me put it that way.
Very well. Now let's get into the statistics, okay? And I would like to read out some figures for you. Now, these are general statistics as regards road accidents nationwide. And according to these statistics, January to February 2023 recorded 2,222 crashes, out of which 2,452 were injuries and 321 deaths, representing 15.35%, 8.27%, and 31.56% reductions, respectively, compared to the same period last year. So these figures from 2023 show a bit of reduction in the number of carnages on our road. But let me take you back in time to accident that took place specifically on the Accra motorway. Now, according to the MTTD, at least 39 people died in accidents in 2018, while 150 were injured. On the roads, 107 incidents were also recorded in that same year. And now, out of 75 accidents that were registered in 2019, 91 people sustained injuries and 36 died. Well, data on the motorway accident also show that 22 people died and 74 were injured in the 80 accidents recorded in 2020. These are quite alarming figures, and I dare say that these are actually underreported. Because the last time I visited a motorway, witness account told me that they could actually witness accidents almost every day. But I believe these figures may seem little, but I believe they could actually be on the high side if we were to digging further. Is this really in a terrible state, per your perspectives?
Well, you see, for us as medics, the health and safety aspect of every road is very important to us. If you remember, just 2 years ago, a little under 2 years ago, November 2021, we had our annual general conference in Sunyani. And one of the key things we spoke about was the menace of road traffic accidents. So if you saw our communique, then you realize that the very first item that we spoke about was it. And at the time, in 2021, I remember we had about 11,580 thereabout crashes happening within that period nationwide. And then over 2,200 of them were, fatalities. And on the average, we're getting about 6 persons dying a day within that period of January to September 2011. So that is a huge loss for the state. I mean, you cannot afford to lose your human resource in that manner. And for us as medics, we usually will see the post crash component of these road traffic accidents. And if you go to our accident and emergency centers, you go to our hospitals, you realize that road crashes actually consume a lot of our resources. We lose lives, and we can conclude that most of these lives or deaths are preventable. Some of the crashes are so fatal that the chances that they will even be able to contribute meaningfully to the economy and, let's say, society, even when we have managed to save them, is such that that contribution will be next to negligible. So they invariably will become a burden on the states. If you look at the fact that our orthopedic, centers are also flooded with all kinds of cases, notably those from road traffic crashes, then what it tells us is that we don't even have enough numbers of these specialized doctors. They are also overstretched by road traffic accidents and its related complications. So all other orthopedic problems that we need to address, aside those caused by these crashes, will also have to be managed or put on hold. Because most of these crashes, when they happen, they are dire emergencies. You need to put everything on hold and fix the patients, save them to the best of your abilities. So it also has a knock-on effect on the overall healthcare delivery, system. And if we don't package our road safety activities well, and also package the nature of the design and the maintenance of these roads that we have, I think ultimately it is not going to augur well for us.
Now, you mentioned something, your word was preventable. A lot of these accidents are preventable. You also said that it actually brings to light a number of issues with our healthcare delivery system. One thing I have noted is the lack of emergency response systems around the motorway. That is to say that if it's preventable, that means there should be some easy access, some ambulance delivery, quick ambulance delivery, or some emergency service being delivered promptly to people who actually get involved in accidents. But we don't see that on the motorway.
But yes, so it dovetails into what I was saying, that the bigger impact of these crashes on our healthcare delivery system. As a country, until recently, when we got this one ambulance, one constituency, most sick people will be transported in taxis and trotros. So you can imagine, even this one district or one constituency, one ambulance kind of thing, even though it is working to an extent, we still have challenges.
So you are ill-equipped.
We are ill-equipped. So if we don't put the roads themselves in good shape, if we don't ensure that there's order and discipline, all the road safety measures that we need to put in place, we don't put them there, then clearly with our deficient status when it comes to some of these emergency services, you can rest assured that we cannot police these highways. We as an association, we have actually advocated that, look, before a road is built, we do environmental impact assessment and what have you. But as a country, we don't do health impact assessments. And we have recommended that health impact assessments should be part of every road construction, right from the design stage till the road is.
Is this peculiar to the motorway or generally?
No, generally. And we have even advocated that on the highways, on the average, after every 50 to 80 kilometers, depending on resources, we should have some emergency centers on the roads. We have advocated for all these things, but of course, we don't have the power to go and execute. So we can only advocate. So assuming...
But we are an association.
Yeah, that's what I'm saying. But we don't fix, roads and all the bits for the people of Ghana.
Yeah.
We can only advocate and bring to bear our expertise and sort of, advice that can help deal with some of these things. So, for example, if we do proper health impact assessment as part of our road design and construction activities, then what we even said in our communiques and the advice we've given, along the highways, and the motorway is part of the highway, it's actually part of the Trans-West African Highway that runs along all the West African countries. If you are going by even every 80 kilometers or 50 kilometers, there should be some emergency response center positioned on the stretch. Obviously, the motorway is one significant spot, or let's say track within that whole stretch. And it will be great to have one positioned there to help save all of us. But we don't have it. So for us, we will keep continuing. We'll keep continuing with our advocacy. And we think that as we try to fix the motorway, some of these things, we can even start developing some of those concepts now to ensure that, look, we have done proper health impact assessments on the motorway, especially in its current state. You see, the motorway has evolved. It used to be a pure motorway, a highway. Now, there are communities on each side of the road. And once the human activity has increased, you realize that there is a need for us to find a good way of separating, in quote, the highway proper from the service lanes that will serve the community. And now that the human population has increased, the human activity on and along the motorway has also increased. This is the best time to do the assessment, right? From, pollution, pollutants, all of these things. We need to do them and have proper statistics or proper cogent, evidence on the ground. That will also guide us in transforming the motorway into what we all want it to be.
Beyond advocacy, don't you think making it legally binding will make it easy for your association to do so?
But that's what we are saying, that, for example, we've communicated that, look, the National Road Safety Act, the latest one, I'm not too sure if the LI has been done, for example, but as far back as 2021, there was no LI. And we think that some of these things, even if not captured in the Act, should go into the LI.
Yeah.
So our advocacy is not just by mouth, but we write position papers and all that. Okay. But ultimately, it is the states and its agencies that will have to ensure that some of these things are implemented. So that if we put in code some of these things down as part of our rules and regulations, then we know that we are getting somewhere. But penning it down in itself is not the end. The enforcement, the policing of these rules, and ensuring that we all adhere to same, and education on the part of us, the citizens, as well as the authorities themselves, will ensure that at least the greater majority of us will know the right things to do. But the motorway as it is now, ultimately we need to fix it because the impacts on our health is obvious for everybody to see. Go to a place like Tema General Hospital, which de facto has become sort of the nearest or the key center where accident victims along that stretch are usually sent. Some come to Kolebu, 37, and what have you. But when you go, you realize that, look, we even need to improve on the services and what have you. And on daily basis, you find one or two victims sent to one of these facilities. So clearly, as you said in your intro earlier, the crashes are happening. Maybe the documentation in terms of the statistics even falls short of what we see as far as the system itself is concerned.
Well, a bit of enlightenment into the kind of public health risk road users are usually exposed to. I, for one, the last experience I had was not an accident, but staying in traffic really did a number on myself because I got down, I felt extremely exhausted. And beyond the carnages that take place on the road, what other health risks are road users exposed to?
Well, some of these things are also a bit dependent on the nature of the roads themselves and which areas you apply. But to look at the broader headings, the first is environmental. So all the pollution from the vehicles. So unfortunately, in this country, sometimes the kind of carbon emissions you see from vehicles, you ask yourself, are these roadworthy vehicles? So the first thing is the environmental pollution, which has a knock-on effect on all of us. Specific to individuals, for example, people who are asthmatics or people who have asthma, some of these pollutants can easily trigger their asthma. So as you stay in the traffic for long, especially if you are not in a position to have an air-conditioned vehicle running and your glasses are all rolled down, and these heavy pollutants are in the air because of the vehicular activity and the dust. Most of our roads are also dusty. So all these pollutants can actually trigger some of these health related problems. Prolonged exposure to some of these pollutants also come with their own health problems. I mean, elsewhere, you know that people are trying to move from what we all use, we are all used to the fossil fuels to what now has been described as a clean energy. So electric vehicles, and the whole idea is to help protect the environment. So it even dovetails into the bigger climate change related, activities that we talk about. And we are all witnesses to the impact of climate change to communities, if for nothing at all, those along the coastal belt, you can see communities being wiped. Those near the deserts, you can see that the deserts are spreading. Even in country, places that look like forests, you can see that now the degradation and all of it is leading to what is getting closer to say shrublands. So clearly, the impacts are there for us. Then, like you said, the long hours in traffic and all that, depending on where you are and the nature of your own, health state. Long hours in, let's say, a very tight vehicle, throttle or whatever, because of the way the roads are designed. Now that the rains are with us, depending on where you find yourself, you could be in traffic for hours. And people who may have problems with, say, their knees and joint, all kinds of things that are already pre-existing conditions, you can have some exacerbation of these problems as well. So the impacts are there for all of us to see. Of course, once you go into the crashes and all of it, then you see even posture. Most of our vehicles, the trotters and the rest, you don't have proper, you know, backrest or anything. So if your posture, you are come to a corner and you have to be in that state for hours because of the nature of our roads. When you get down and you think that you're having some back pain and all that, prolonged exposures of that nature will actually lead to bigger problems.
So long term wise, people are likely to suffer the effects.
Yes,
in some years to come.
Well, clearly, I mean, if you see, it's like a cause or a risk that potentially could lead to some health problem. Once there's a risk, it does not necessarily mean that every single risk that you get exposed to just for a brief moment will result in the ultimate. But prolonged exposure to the risk could speeding the rate at which you move into that kind of ill health status as a result of that risk.
Very well. Now, you still talking about assessment and why it's very important that we have assessment on roads before they even go into execution and some construction phase. Per your observation and assessment your association has done internally, what would you say has been the contributing factor to the road accident on the Accra Motorway? Have there been any issues that have stood out for you?
Well, I think that's, I won't just say if it's just the Tema Motorway, but the factors cut across all roads, or let's say all our highways. So there's always the human factor, where drivers themselves either probably not properly certified, or they know they have defective, vehicles or whatever, but they have refused to fix them, either overspeeding, either the person is doing, drunk driving, or driving under the influence of alcohol or some other, narcotics and stuff like that. So the human factor is always there. And that will always contribute to you know that maybe you don't have to drive for long hours without rest. Some will go long hours without rest. Even the nature of the enforcement by our law enforcement agency, the Road Safety Commission, the MTT, and all of them. So clearly where you can see obvious presence of officers who are doing diligent work, people try to comport themselves. But when there's nobody around, you know how it works. Tema Accra is also it's a twin city, but there's a lot of economic and social activities. So sometimes over the weekends or late at night, people may have gone to have their own rendezvous. Either way, they are going back. So clearly the human factor is there. Then there's also the business of the vehicles themselves, their roadworthiness. If the vehicle is not roadworthy, the chances that you run into some problem is high. And the mistake on your part or the failure on the part of one vehicle will actually set a cascade of events where you have multiple accidents or multiple vehicles involved in accidents at a stretch, and the implications will be there for us. Another factor is the road itself. And here we are talking about the design, the nature and design of the road, as well as the sort of accessories or supporting activities. If the design is properly done, you realize that it will limit impacts in terms of the risk. If you have all kinds of the accessories like the markings, the lightning, and all of it. If all of them are in place, we realize that it's will limit, these crashes. If the road itself is properly constructed without manholes, potholes, and what have you, where to turn, where not to turn, if the designs are good, where to exit, where not to exit. If you go to places like, say, the US, most highways, you don't just join them the way we join roads here. There's always an exit that takes you off the highway, and you can only come back onto the highway through another mechanism that basically makes it safer for entry and exit. So the road itself, right from design to construction, and subsequently the way we do our markings, lightning, and all of these things are factors that will contribute to a crash or otherwise. Why should we still, at this day and age, as a country, be doing single lanes on our highways? Clearly, it is recipe for disaster. The world over, it's been proven that dualization of roads, especially highways, will save all of us from head-on collisions and what have you. But here, if you take small segments of, let's say, Accra to say Nsaom, then to say Suhum, maximum, let's say, in Koko, the rest, if you go on the Takrade stretch from Kaswa all the way to Takrade, basically it's a single lane. From Accra towards Aflao. So clearly, the state of our roads in itself are major contributing factors to the crashes.
It's not looking too good for the picture you just described. But as for regular users like myself and people who are listening or doing the watching, how do we make ourselves safe?
Well, I think the safety, for me, should be a two-way activity. First is the state itself, and two is us, the road users or the end users. The state should do its best to ensure that together with its agencies. So when I say the state, I mean central government and all its agencies, departments, what have you, who are responsible for our roads. They should ensure that the roads are in good condition and as much as possible, they are safe for all of us. And then the rivers, which is us, the users, just as we discussed, the human factor is always there. So we need to educate ourselves properly on some of these things and ensure that we don't do things that will escalate that human factor. The human factor also goes into a bit of the enforcement, which is for the states. The state should also enforce because where the citizens refuse to obey rules and at the same time you don't see any enforcement, then it becomes as if that conduct is normal. But if the enforcement is done properly, most likely for us as users, we will fall in line in terms of what ought to be done. And then once we've set up structures like the Road Safety Authority and what have you, they should also do their best to educate us and uphold their mandates and ensure that we are all safe.
Now, you are ensuring other agencies also are held accountable. And I'm just curious as to what your association is also doing long-term wise to also play its role in ensuring that the public is safe.
Well, just as we discussed, and I'm sure you've been part of GMA activities, periodically we highlight these things. We write position papers. We send these to all the state agencies and individuals that matter, including the president of the land. We sit down with them to discuss some of these things. It is not an everyday activity, but periodically we meet, we discuss, and all that. We bring our suggestions to the fore. We actually volunteer to be part of any activity that will help, limit these things. So for us, it is not only about just advocacy, say on radio, but we go the extra mile to talk to the movers and the shakers to ensure that things are done. But of course, we also have limited resources.
Yeah.
We can only do up to a certain point. And sometimes it becomes a bit frustrating. Beyond that, we also ensure that those who unfortunately are involved in crashes, we do our best to save them, to fix broken limbs and what have you. It is not easy. For orthopedic surgeries or crashes, or surgeries involving crashes, sometimes you may need a neurosurgeon, you may need a plastic surgeon, an orthopedic surgeon, a vascular surgeon, all of them together to work on one person, let alone you talk about anesthetists and what have you. So clearly, we are doing our best to help manage the situation. And even post surgery, we still have to supervise the recovery phase. Then other health professionals may also come in, physiotherapists, what have you. So it is not something that we take lightly. We are doing our best beyond the advocacy to also help ensure that things are more or less sorted out at the post crash levels. But we believe that, as they say, prevention is better than cure. And that is why we keep doing the advocacies to ensure that ultimately the numbers will reduce, if not eliminated completely, and then we can have a decent society to live in.